time of the day. Guys, I really want to thank you for your support. We're really blown away for all the comments, the calls that we got over about 4 days. We got, I think, more than 100 subscribers, which we're going to celebrate with this video. We had a lot of likes. We actually had people contacted us. And I want to thank several people. I want to thank Christine Fields, to thank Andrea Schwartz for making this project possible. I also want to thank Cheryl Hirsch for contacting us. We got several questions and I want to answer them. Before I do that, I want to emphasize that we do our best to provide accurate information, but as any clinical scenario, you need to talk to your provider, you need to talk to your physician before making any decision. This is just for information. Obviously, talk to them first. Second question we got is, who are we? Are we affiliated with any state or federal program? We're certified by the state of Ohio as a pain management clinic, but we are completely independent. We're not subsidized by anybody. We do it as volunteer work just to help you guys and to help our patients. We did create a lot of materials for our patients over some time, so it makes it easier to share it with you. And the main question that I really want to dive in, that we got from several subscribers, is what are my chances to develop addiction? It's a very complex question, and it's not just asked by people who are abusing substances, who are treated for addiction. It's actually a very interesting question. What are the chances to develop addiction when you're exposed to a substance with addiction potential? It doesn't have to be heroin. Obviously, it's an illicit substance, but a college kid who gets his first alcohol party. It could be food addiction, right? A person who involves in playing games excessively. It could be a person like anybody here who is going for surgery and getting his first Percocet for a few days. What are his chances to become an addict? It could be a chronic pain patient who needs pain relief. What are his chances of becoming an addict? So in order to answer these questions, we need to understand what is addiction. We got a definition in our previous video that I'm going to refer to, but we need to go deeper into differentiating between addiction and dependence or tolerance, and that will help us to understand what are the chances and what are the dangers of becoming an addict or developing aberrant drug-seeking behavior. So let's look at what tolerance is. Tolerance is a state of adaptation in which exposure to a drug induces changes that result in reduction on one or more drug effects. It's a fancy statement that, taken from the literature in plain language, tolerance is when you getting used to a medication. Common scenario, person with a low back pain, getting pain medication for a long time. Initially he feels wonderful, he feels that the medication helps, but after some period of time he feels that the same dose of medication, and that's another definition of tolerance, is not helping anymore, and he needs higher dose of medication. More than that, he feels that if he doesn't take the medication, he would feel jittery, he would sweat, he would be not himself. And he is concerned whether or not he is becoming an addict. Another simple example, person who likes to binge on ice cream, on sweets, and then suddenly, his doctor tells him, look, I checked your hemoglobin A1C, it sounds like you're pre-diabetic or diabetic. It's dangerous, you kind of have to stop. And he tries and he suddenly feels the same way. Is he becoming an addict? So the answer is, like in many things in medicine, it depends. Actually, the responses that I described are not addiction. There's something called tolerance. Tolerance is expected physiologic response. In other words, if you take any person on the street, average person, and expose them to the substances with addiction potential, they will become tolerant. They will need more and more to get the same effect, and they will feel what I described right now, which is withdrawal. It does not mean that they are addicted. And that answers questions to a lot of people and a lot of patients that we see, and I'm sure a lot of questions that subscribers raised. Are they at a risk? Are they developing addiction? And the answer is these symptoms, just the fact that you need this medication to function, and the fact you need higher dose and you may feel withdrawal, it does not mean you're addicted. It means you are tolerant. And it means you need proper follow-up, you need proper education, you need good medical care to make sure it does not going further and you don't develop aberrant drug-seeking behavior or addiction, which is now called substance use disorder. And I want to remind you from previous video that the hallmark of addiction is the use despite negative effects. In our scenario, if we see that that person who is exposed to alcohol or pain medication still takes them when they see they don't help, they actually destroy his life or her life, this is a sign of addiction. If a person fails to fulfill major role obligation in the family, at work, that's definitely a very concerning sign. He may be developing substance use disorder. And if the person has recurrent use in hazardous situation, in other words, person many times understands that it's dangerous to do, but nevertheless, it's like a virus on the computer. Nevertheless, he finds himself using the substance that he cognitively understands may be detrimental for him. And we will discuss later in further videos when we will talk about what can be done. Understanding the problem is important, but it's not enough, and many times will not fix the problem. But this is one of the signs that the person deep in the heart, and if he is completely honest with you, understands that it is dangerous, understands it is dysfunctional, understands it has negative effect on his life, and keep using this medication. So who is at risk? The question was, am I at risk on developing this? And the answer is, it depends. Actually, I would compare it to driving. Anytime, like we did in the first video, actually I drove here and I'm sure most of you guys drive. Each time you get in the car, is there a risk of motor vehicle accident? And the answer is yes. Each time you drive, there is a risk of motor vehicle accident. The question is, how high is the risk? Most of the time, if you drive decent vehicle, you know how to drive, you follow the rules, the risk is very, very low. However, there are people who are at higher risk for motor vehicle accident, and this is the statistics. People with cognitive disabilities, risk of seizures, risks of alcohol or substance abuse, or people who consume these substances, obviously, they're intoxicated, they're much higher risk of accidents. So I would say, oversimplifying things, that something similar exists with addiction. Is there a risk of developing addiction? I would say yes, there is a risk. But usually it's low for many people, but there are certain risk groups or certain situations or certain setups, or when there is lack of proper monitoring, education, which is we're trying to improve, then the risks are much higher. What are the risks? What are the risks? First of all, Is it genetical? The answer is, again, it depends. Definitely, there is a genetic component in addiction. Um, Definitely, there is certain percent of people who have predisposition for addiction. But again, it does not mean they will become addicts, and it does not mean that people without this predisposition cannot become addicts. I would again compare it to diabetes. If a person has genetic or family history of genetics or family history of diabetes, they're high risk for diabetes, but with proper care, dieting, healthy eating, exercising, they may not know about that. They may be very healthy and not develop diabetes. On the other hand, if they have an unhealthy lifestyle, actually these genes can come up and develop diabetes when the other person without those genes may not develop it. I would compare it to addiction. So first, there is a genetic component. We know actually that family history of substance abuse is one of the risk factors. Personal history of substance abuse, just exposure, was again unfortunately very high in the United States. We're very tolerant to alcohol consumption, alcohol parties for young adults. We prescribe a lot of controlled substances in comparison to other parts of the developed world. We do a lot of surgeries, and guess what happens after surgery? People get narcotic medications or around surgery. Women, history of pre-adolescent abuse, mostly sexual abuse, and people with psychological problems, major depression, anxiety, bipolar, post-traumatic disorder, and even minor or fairly minor problems like attention deficit or obsessive compulsive disorder or other psychological problems can predispose person to addiction. So what are the practical components? What are the practical conclusions? What you can do about it? What you can do with this information? First, you need to assess your risk. Are you in the high risk group? Secondly, you need to assess your exposure. Are you exposed to these substances? And what happens, right? And some of that we can control. And the third thing, is there good monitoring? Good education around you. If you control these three components, you can decrease the risk of addiction and stay safe. I would again compare it to driving. Is there a risk of motor vehicle accident? I said, yeah, all the time. Anytime you get in the car, there is a risk. You know what you do. You're not intoxicated. You drive a good, safe vehicle. The risk is very, very low. And the risk of driving is usually lower than the benefit of driving, and I would compare it to addiction. There is always a very low risk for usual people. Many times the treatments have higher benefit than the risk, but that makes it so complex, and that's why in a complex situation you need a certified healthcare provider with proper training that can tell you in your situation whether the risk outweighs the benefit or not. So, in summary, we talked about what is tolerance, what is normal, what is physiologic. We talked about what is abnormal, what are the signs of addiction. We touched on the risks, and we said that each person should evaluate him or herself in terms of the risks, the family history, exposure to controlled substances, history of psychological or psychiatric disorders, and availability of good care and good monitoring. And by educating himself, by monitoring the environment, you can decrease this risk to minimum. In the next videos, we will talk more about specific actions, including lifestyle modifications, including diet modification, exercises, including how to monitor or what resources a person has if he or she requires, for example, chronic pain treatments, or they can be exposed to that type of an environment what they can do. Again, many thanks again for your support. It's a pleasure, and it's a team effort of Comprehensive Pain Management Institute. We are a full provider practice here in Columbus and in Cleveland. Thank you so much for being with us. It means the world to us.
Hi, my name is Linda Adams, and I am currently a patient of Dr. Magolian. He has been a great person and supporter of the problems that I have had. He is very delicate, very explanatory, and very kind. He makes having a situation like this easier to deal with.